Dermatology Associates has led the way in Atlanta for years, being the first to bring numerous medical advances and specialized treatments to dermatology patients throughout the Southeast. Meet Dr. Edmund Griffin and Dr. Scott Karempoulos. Dr. Griffin's instructors at Dartmouth were greatly influenced by the Mayo Clinic's, Bethesda, and Harvard programs, and it was those models of excellence that Dr. Griffin was determined to bring to the people of Atlanta.
Establishing a laser center was also one of my priorities. When you looked around, where could a person go for a simple laser treatment? I just completed my residency at Dartmouth. And at Dartmouth, I was instructed by 3 great instructors that really inspired me. And inspired me enough that I wanted to bring what they taught me back to Atlanta. But I knew in a private practice, which I wanted to set up, I wanted to be able to provide that latest care to all the patients of Georgia. That's when I, in the early 80s, wanted to establish the Laser Center. And of course, Dr. Karempoulos really helped me make that center grow, expand it, helped me with the research on it, and helped really develop it as one of the main treaters with lasers today.
There are a lot of exciting uses for laser. Every year we just find more and more uses for these, and we have new lasers built for specific indications. For tattoo removal, the Q-switch lasers are the best. They provide a very short burst of energy that shatters the pigment into small pieces and your body absorbs it. Facial veins is probably one of the most common treatments that we do in our office. There's no blisters, no sores, it's not very painful, and really can keep ahead of the nuisances of facial veins. Brown spots are probably the second most commonly treated lesions in our office. They can be removed with Q-switch ruby lasers, erbiums, several different systems, very safely and effectively. For wrinkles, we have several different options depending on how much downtime the patient can give us. We can actually do some remodeling of fine wrinkles with some no downtime lasers over several months and just nice plumping of the skin. With just a little bit of downtime, we can get some moderate reduction of wrinkles and dyschromia. If you can give us a 7-day downtime, we can get some more severe wrinkles, maybe some lines around the mouth and the eyes with greater accuracy and more precision. Hair removal has been a procedure we've been doing for many years. We evaluate skin type, hair color, and the areas to be treated and give them the best machine. We really do a good job with hair removal. Our laser center is really closely integrated with our large dermatology practice.
Another focus of Dr. Griffin was to establish one of the first approved and accredited surgical centers for dermatology in the South.
Surgical centers are not really easy places to establish. There's so many details. Besides, I wanted it to be accredited. And I'm proud to say that our center was one of the first dermatological surgery centers anywhere, much less just the South. Some of the things that we were able to offer were eyelid surgery. We certainly used some of our lasers on patients who had special problems. We did liposuction surgery. We were one of the first centers to even think about doing liposuction, and we offered it on an outpatient basis, or at least through our surgical center. Another building block is our medical spa. All of our doctors here are board-certified dermatologists, and any treatments that are recommended by them in the medical spa are carried out by our certified estheticians, whether it be a chemical peel or an acne treatment or anything else. The estheticians can carry it out just as the doctor ordered. My favorite part of work is anything that makes patients happy. So therefore, I like to do things like Botox, dot laser treatments, hair transplants, and liposuction. That's my big four.